World health leaders are warning the pandemic is far from over. Some states are starting to see Omicron cases decline, but they're rising in other states. Yesterday, Indiana reported more than 16,000 new cases. Take a look at that map. Every county is in red, meaning the virus is spreading quickly in all parts of our state. This morning, our Emily Longnecker explains the help Hoosiers are leaning on to handle the surge of people showing up sick.
Doctors here at IU say they are busier than they have ever been, so it's no surprise that they've asked a team of FEMA medical personnel to stay on an extra 30 days. The group of doctors, nurses, and respiratory therapists have been in the mix here at Methodist Hospital since late December. Turns out they are still needed as more hospital staff get sick from COVID or has to quarantine because of exposure to it. With the surge in COVID cases from the Omicron variant still not likely at its peak in Indiana,
we know we're still going to need all the help we can get for the next 30 days.
That means the medical team from FEMA is here to stay for the next month, continuing their work that started during the holidays.
Well, they help from the emergency room, our med units, and in our ICUs. So we are scheduling them just like we would our own team. And really, I think the value of that FEMA team has been to not only provide direct patient care, but it's also been able to provide some relief to team members working alongside them.
Even as the number of COVID patients across IU's health system went down briefly, Dr. Mark Lutenmeyer says they're on their way back up again with 634 COVID patients in hospitals across the IU system. 175 of those are at Methodist.
We have seen some increased discharges lately, but we are also seeing the total number of deaths rise. And so this has been the highest 30 days of deaths that we've seen since 2020's winter surge.
Of the patients IU is seeing in its hospitals on a single day, 70% are unvaccinated.
We are not seeing ICU patients with COVID that have been both vaccinated and boosted.
Dr. Lutenmeyer hopes the arrival of an at-home test kit from the federal government will make it more convenient for people to know if they're positive, particularly during a surge.
We know that at-home COVID tests aren't perfect. But they do give you more information than not testing at all.
And with flu season here and the number of those cases going up, doctors are watching closely, concerned about extra health care and hospital needs to deal with that too, on top of Omicron.
Right now, there are several nationwide efforts to slow the rapid spread of the Omicron variant. It all boils down to tests, vaccines, and masks. The White House site, covidtest.org, is up and running, sending 4 free at-home tests to households that sign up. That means you can get them right now. And 650 clinics across Indiana are offering PCR tests. The state confirmed they have not received more rapid tests since last month because of the shortage, and their stock is depleted. But pharmacy clinics may still have rapid tests available. When it comes to vaccines, most clinics have plenty of shots to go around. Yesterday, the CDC released research showing how crucial vaccines are to avoid catching COVID and ending up in the hospital. The study of 1 million people found vaccination combined with natural immunity offers the strongest protection against the virus. Making up the third part of the puzzle is the government sending out masks. The government is sending out 1 million free N95 masks next week. You have to pick them up from pharmacies and community health centers partnering with the government. If you need a mask in the meantime, make sure you buy one that is legit. The CDC estimates about 60% of K95 masks sold in the U.S. are actually fake. Happening today, the Governor's Public Health Commission will meet virtually to discuss how data is used to inform public health actions. It's from 1 to 3 this afternoon. The 15-member commission was formed in August. The group focuses on areas including governance and structure, funding, emergency preparedness, workforce, and the integration of childhood and adolescent health services.